So I'm recording. All right, so remotely we have Sandy Unger, Joanne Rubino's excused, Kadian, unless anybody knows her whereabouts, I'll mark her absent until further notice. Same with David, unless somebody knows about him. Looks like Serena's also
No.
online. Susan emailed out. Juanita's in person, I think
Yes.
Cynthia said. Rich Reynoso emailed out, and then Cynthia's in
Well,
person.
he said he may come in, Jeremy, he said he may come in later because he's working.
Yeah,
So would
okay.
he be excused? Okay,
Yeah, I mean, we'll see. We'll mark him. I'll mark him excused until if he changes, Cynthia or somebody can mark it on the attendance sheet.
okay.
Jeremy, are you only counting committee members or any community board members?
No, committee members, because that's what you need.
Okay, thank
Technically,
you.
you need a quorum to start the meeting, but
Now that sounds like Naomi.
Yes, it is.
Okay, I was correct. I know the voice. Okay,
I'm coming to your meeting tonight. Excited.
it's quite all right. You're welcome. You'll be in the gallery or again.
Okay, perfect.
All right. So everyone, now is Sandra Horn here from Abbott House? I guess not. Maybe she's having trouble signing in. All right. So, Jeremy, do we have all the people who are in attendance?
yeah, I mean, I marked down the attendance. So I'll check my email, see if there's an email that somebody's having a problem getting in. Otherwise, it's all yours, Sandy.
Okay, yeah. I mean, this is crazy. I don't know why. I'm trying every, Apple product I have. Okay. I want to welcome everyone here, and I would like them to
I'm
say
sorry,
who they are.
Sandy, can we start with the date and time? Just to,
Oh, yes, you're right. I'm sorry. I thought that, okay. Today's date is May 14th, and the time is, about 7:12?
7:13
Yeah.
p.m.
Okay, 7:13 works for me. All righty. I want to welcome everyone. We were supposed to have 4 speakers. I hope that we will be able to hear everyone. And if they would like to let the people from the community board introduce themselves, and then we'll have them introduce themselves. All right. I'm Sandra Unger, Chair of the Health and Human Services Committee. Go ahead, Cynthia.
I'm Cynthia Rodriguez, member of the committee.
Juanita Ransel, member of the committee.
Okay, so it's only the 3 of us. All right, will the speakers, Earlene?
Serena, I believe Serena Muniz is online.
Oh, okay, well, then she has to introduce herself, because she's on the committee. Serena? Well, maybe she'll come back in, but let's get the speakers to introduce themselves, and then we'll start with their presentation.
Check in.
Earlene?
Oh, wait.
I'm
is she
here.
online?
No, I'm here.
Starting line.
So, good evening, everybody. My name is Earlene Wilkerson, and I work for the Center for Human Development and Family Service.
Thank you.
Just the X.
Ms. Julia?
See the red X in the corner?
No, that'll
Hello?
Oh, sorry. Sorry. No, it's
Is someone there
Hi,
from the nurses?
good evening. My name is Julia Kamagong, from the New York State Nurses Association. One of our nurses, and her name is Claire Hughes. She will be speaking on behalf of NICENM. Thank you.
Does she spell her name Hughs?
I'm sorry.
I asked if she spelled her name Hughs.
Yes, Claire.
Okay, thank
CLAREHUGHES. Yes.
Yeah. All right. And Giovanni, I hope I'm pronouncing it right.
No worries. I'm Shivani Agarwal. I'm one of the physicians at Montefiore, and I'll tell you more about myself in the presentation.
Okay, great. Earlene, we'll let you go first.
Thank you.
You're welcome.
So, I'm here today to talk about, some services that we offer the community. So the Center for Human Development and Family Services is a nonprofit organization that works directly with the Administration for Children's Services, which is ACS. And we work with them on child safety conferences. The parent advocates that I supervise work directly with the families that are being investigated about situations that put them and their families in harm's way. Now, I always explain to my family how easy it is to get a case with ACS and how difficult it is to end the case. But the parent advocates work tirelessly to do the best job they can to sit with the families and listen to what they are saying so their voices are being heard because they know their children better than we do. I started this position from the beginning as a PTA president when my children were in elementary school and continued and followed them through middle school. By high school, I became a parent coordinator for the School for Arts and Science and along with section of the Bronx. During this time, I engaged as a community rep in the hybrid section of the Bronx where I have lived for 49 years and raised 7 children and 12 grandchildren. It has been a rewarding experience. To become a parent advocate, you have to have had some experience with the Administration for Children's Services, maybe a case or a foster care, been a foster care parent, or possibly been a foster care child at one time. My case was I fostered my grandchildren at one time. The parent advocates go through a series of training so they know how to help our families. Having an advocate by your side at an initial child safety conference is a great support to the family to know that the advocate is there to listen to you. So the conference, what happens is when the State Central Registry is called with a case, a caseworker is assigned to that case. And then they visit the home to explain to the parent what has been said at the State Central Registry, what cases come in, who's involved and what happened. So they come to your house and they ask to sit with you and explain why they're there. So they talk to you and then they invite you to what's called an initial child safety conference. If the parents are willing, and most of them are, because they want to know what this is about. Sometimes they don't have any idea. You can also not allow a caseworker in your home if you don't feel comfortable enough. And they would have to go back and come back with a warrant to sit and talk and be allowed in your home. Most people want to know what's going on, so they allow you in the home. And then they're able to explain to you what's going on. If you decide to attend the initial child safety conference, it's usually scheduled a day after or two or 3 days after. And when you come to the ACS office, now since the pandemic, most of the conferences have been done virtual, like what we've been doing during these trying times. And when you get there, you're introduced, the caseworker is there, the one that came to your home. Her supervisor is there in case you want to speak to the supervisor. The facilitator who runs the conference smoothly, or is the best for her ability, she runs the show to make sure everybody has a chance to speak. And then you are introduced to a parent advocate. A parent advocate has to have your permission. She explains her role, and then she asks for your permission to sit in on your conference so that she can help you and answer any questions that you might not understand. The job of a parent advocate is that by the end of the conference, you should have a clear understanding on what this conference is about and which way is it going to go. The parent advocate gets the permission from the parents to sit in the conference, and then the conference begins. It starts off with the facilitator and the caseworker telling why the parent is here. First, they usually ask the parent, does she know or he know why he's here? And most times, the caseworker has already gone through that when she visited their home. But sometimes, they still don't understand. So they do it again. They explain why they were asked to come to the conference and what are the concerns of ACS. After that, the parent is able to talk about, is this something that really happened? She has another version of it, and she's able to speak her piece. And after that, we talk about things that work well for the parents, things that they do well. It could be just getting their children to school every day, or being involved in their children's education, medical, just things that do well, because all parents have strengths. So we talk about the parents' strengths, resources, and support. People that they might have that they turn to for support. There are a lot of people who don't have a lot of people for support. So that's why the advocates are there. When these go through certain steps, and we get to a part where you can speak to your advocate one-on-one after ACS has given suggestions and services that they might recommend for your family to get back on the right track. The parent advocate sits with the family alone, private time, which is called family time, and talks to the family about what services that have been recommended that they might think is going to be useful. And so when that's done, that's the parent advocate and the family alone, family time. The family is to explain the best way they know how, or ask questions about what these services are supposed to do for them. And then after 15 minutes, they come back to the group and tell the facilitator and the caseworker and the team whether they've decided to agree to these services or not. Now, this is a part where parents are very nervous because ACS, whether the parent agrees to the service or not, can still ask the judge, if the case goes to court, to implement and mandate these services. But the parents are represented by an attorney in court. And they have time to talk to the attorney and explain to the attorney whether they want the services or not. So even if they go to court and ACS recommends these services for the parents, and the parents tell their lawyer, well, I don't think I need those services, the judge has the final say. He is the one that will mandate the services that he thinks is necessary, or if the lawyer says, well, she doesn't want these services because, and he'll explain why the parent doesn't want them. This is a long and trying process. The conference usually lasts an hour and a half, and some services are done through two conferences. The parents will have their own separate conferences if it's something that involves domestic violence or anything of that nature. We here at the Center for Human Development and Family Services want to offer these services to all of Community Board 11 and the members and the families if they find themselves in a situation such as this. Whenever a case goes to ACS, through the State Central Registry, an initial child safety conference is called, and our parent advocates are also called. So you would automatically get a parent advocate, and you would give them permission to sit with you and guide you through this. That's what I want to offer Community Board and their families. So this is what I'm here to talk to you about. I don't know if you've had some families that might have cases like this, but if you do, I want them to know that we're here for them. You know, sometimes it's very difficult because there are different outcomes that come with initial child safety conference. Sometimes the judge might decide that a removal from the parents is necessary until they can get parents in services that might help their family. And so when we sit down and we talk to a parent that possibly may have their child removed, it's a very emotional time. So this is what I would like, this is why I'm here. I would like to offer this service to anyone that you think you may know or is going through these changes or difficulties, so we can get them back on the right track, because families are so important. And there's so much going on in this world right now.
Okay.
So basically, that's what I'm here to offer. Does anyone have any questions for me?
I have one or two. First of all, is there a phone number that can be given to get in touch with the Human Development and Family Services?
Yes.
Two, is
yes.
there a fee for the services? Okay.
Okay, I heard the first question. What was the second?
Okay. The second one, is there a fee, or is this done
No,
free of cost?
no fee. We are a nonprofit agency, and there's no fee. And especially when it comes to getting help for your children and for your family. So no,
Right.
there's no fee. Okay. Sometimes you might know someone who's saying, "Oh, ACS has been in touch with me, and I don't know where to go and what to do." I will give this number and some other things to Community Board 11. So it'll be somewhere in your office where you can just put them out, pamphlets, leaflets, if that's possible. Is that something that I can do for you?
Well, we could ask Jeremy if that is doable. But having the phone number, and if the people in the office have it, and several of the members of the Social Services Committee have it, that would be helpful, I'm sure.
Okay. So there is a number that's direct. And I'm sorry that I'm in my office right now, but it's, I don't have the direct, but I can call up tomorrow and give y'all all the information that I need that I did not have in front of me today. Would that be
All right,
okay?
that's fine. Hopefully, you can call me. I don't know if someone will be in the office tomorrow. There should be, but I don't know. But you have my number, Colleen.
And so you are Ms. Unger?
Yeah. Correct.
Yes. And I thank you for all that you've done to get me here today, Ms. Unger.
Oh, you're quite welcome. Thank you. And does anyone else have any questions for Ms. Wilkerson?
Ms. Wilkerson, do you guys have a social media presence at all? Any kind of flyers or
Yes,
printed
yes.
materials that you can share?
Yeah, okay. So first of all, you can find us on the website of CHDFS. It's called the Center for Human Development Family Resource Services, CHDFS.org. Not only do we have that program, we have a few other programs, like we have early intervention for children that from ages 3 and up. When you find the doctor saying that there might be some developmental issues, we have a program that comes out to your home and services the children from ages 3 up to 5. When they get up to 5, they go into the preschool for special education. But
So
when they're little like that,
So you're doing
Excuse me?
some intervention then?
yes,
The
we do
children-
early intervention here. Yeah. There are,
Okay,
when
thank
you get on the website, it will show you all the services that we offer. I am supervisor for the parent advocates, so that was the one that I really wanted to get to the forefront, but they're all important. We do OPWDD also for children who have special needs. So
Thank
all
you.
of those are on the website.
Thank you so much. Does anyone else have any questions?
Go ahead.
I've included the website in the chat if anybody wants to go in.
Thank you,
very
Cynthia.
much.
Thank you. And
You're
thank you
welcome.
again, Ms. Wilson. And you'll call me tomorrow.
Most
Correct.
definitely, Ms. Unger.
Terrific.
And thank you,
Great.
all of y'all, for listening and letting me help out. Hopefully, this will help out a lot of our families.
Thank you.
Thank you,
Bye.
committee, for allowing me to speak. Y'all have a wonderful evening, okay?
Thank you.
Thank you. Great. All right,
Thank
Julia Cameron. She would be next from the New York Nurses Association. Oh, and Claire Hughes.
Hi,
Hughes?
good evening, everyone. Let me just start my video also. Good evening, everyone. My name is Julia Camagong. I'm with the New York State Nurses Association, or NYSNA, and we represent 42,000 nurses across New York State, and we also represent the nurses at Montefiore Medical Center. So we want to thank CB11, the Health and Human Services Committee, for letting us join your meeting and present some concerning things about the Hutchinson campus at Montefiore. And with me attending are nurses from the Hutch campus. I have Patricia Armand, Jackie Annam, Rebecca Krug, and Claire Hughes, who will be speaking on behalf of the group. We also have NYSNA program representative, staff just like me, Noemi Barrera. Miss Claire is connected via three-way in Noemi's phone. So Noemi, whenever you're ready, you can unmute so that Miss Claire can speak and address the group.
Thank you. Are you ready to speak with you?
Noemi is online, and I just told her because Miss Claire had trouble connecting on the WebEx, so they did a three-way.
I know you're not alone. I had trouble connecting and I could not
Yeah.
get up. All right, but can she talk now?
Yeah, I just texted her so that way she can unmute herself, and let me call her. I don't want to call her because she may get disconnected.
Having difficulty unmuting. 1 second, please.
Okay.
Claire, just speak. I'm going to put you on speaker on my phone. I'm connected online also. Claire? Claire? That's not going to work. Claire? I could hear you, but is there any way to unmute the 8214 number?
I don't have host powers. Let me see.
Because she's muted.
It's here.
Can she do that on her own phone?
It won't allow her.
Request
Oh, give me 1 second. Claire?
Or can someone else speak then?
Yeah.
Claire, hit *6.
What about doing *69? That's what I did.
It's telling her to hit *6, but it's not unmuting her.
I think try *69.
Can the host of the meeting unmute her from the WebEx.
I'm trying to call him now.
Sin, it's saying Serena's a co-host. I don't know if she's on.
I don't know either. But when I had so much trouble, and then I finally just had to get on my phone, and then I don't know how I finally got on. And Jeremy said, yes, they upgraded their system. See, they don't leave things alone. I never had trouble with WebEx when I went on my iPad. Now we'll have to figure
Yeah,
it out.
I had to re-download myself, Sandy. So
Yeah, you came on your cell phone, correct?
yeah, I had to do it on my phone.
Yeah, but I wanted to do the video with the iPad, and I have done it for like whenever, the last year or so, and now I couldn't do it. And they wanted me to use my finger ID, and that's not working. So Jeremy said we'll troubleshoot after the meeting or another day. All right,
okay.
Julia,
Yeah, is it
is
possible
Claire
to
in trouble? Maybe you
move
want
on to the
take
next
over
speaker,
for
you
her then?
think? Or while we try to troubleshoot, because she's on the line, but she's muted. I see her number here, in the 917, the one that ends in 14.
Yeah.
Stand by. Another committee member is trying to see if we can get it done.
Okay.
Should we, while you're doing that, should we have Shivani speak? And then Ms. Hughes can come back later? What do you think, Cynthia? Cynthia? Hello? Hello?
Sorry, Sandy.
Hello.
Give us.
Oh, okay. Did you hear what I was saying? Should we have Shivani speak while Julia and Claire are trying to unmute?
So we're gonna share your presentation?
We'll share.
Yeah.
1 second, Sandy.
All right.
Right down.
What's there?
Question. Oh.
Okay.
All right. Can everyone hear me?
If you're Claire Hughes, I can.
Okay. All right, great. So hi, everyone. Thank you so much for having me. It sounds like you have a big panel of speakers today, so I appreciate your time. So I wanted to just introduce myself a little bit, but I'm really here as kind of a humble, in a humble way to just kind of introduce myself, my new role, and kind of continue conversation. So this hopefully is the start of something new. All right, if you can move the slide forward.
Sure.
No, not in chat.
Oh, wait.
Sorry, some tech.
Get out of here.
Oh
my gosh.
You're doing great. It's awesome.
We're all chipping in here today.
Yeah.
And
Yeah,
it's greatly
okay.
appreciated.
All right, so my name is Shivani Agarwal. I'm a physician by training, and I'm newly appointed to this role as of January by my Montefiore Einstein as the Senior Director for Health Equity. So, what does that mean? We're kind of trying to figure it out as we go. We have some ideas, but I think I'll tell you a little bit about myself first and why I'm here. So I actually was born in India. I moved here when I was 3, and my first step on US soil was the Bronx. So I lived in the Bronx for the first 5 years, over on Wayne Avenue. I don't know if you guys know, but Marconi's was like my first bite of pizza. And we had like our Greek place down the street. So I really have a fond love of not only New York, but the Bronx. And so I did all my training and then came back here because I just think it's just a really special place where we do actually celebrate each other's differences. It is still a melting pot very much, and like we're strong New Yorkers. So it's like the perfect combination of things. The middle column there is really kind of how I think of what health means and what health work means and how I kind of live my life. So just like people are sick, I think systems are sick. And so if we don't treat the system, then our people have no chance, right? And so I really focus on how can we improve the care systems that we all have to move within, whether we're providing the care or we're receiving that care. And so I have some kind of training in that. And then I also believe in that middle panel, really that every single person has a voice. I think a lot of people have good ideas and they just never get up to the surface. And so, you know, people, what we say is on the front lines, whether they're staff or patients or families or community members, I think everyone needs to be in the conversation. And I think we're all here together for the same reason, that we want to move that trajectory, right? And so I know this sounds hokey and we all kind of come with this mission, but like it's real, right? So I think that's why we're here. My credentials are on the right, you know, whatever. I'm a associate professor of medicine and endocrinology. I work in the Diabetes Institute, so I'm actually a diabetologist. So I treat people with diabetes in the Bronx. And then I have spoken both internationally and nationally in health equity. And really, again, how do we redesign health care and incorporate community and patient voices to actually do the work we know we need to do, but within and then outside of the walls of the health center. So that's me. So I just have some questions for you, and these are meant to be broad and kind of abstract. So, you know, you lead me, but I wanted to just start a conversation. So in my new role, I am supposed to be responsible for closing gaps in clinical outcomes that we know we have in the Bronx. It's not a one-person job. It will take a village. And so this is like me coming to you to say, what can we do? Okay. So I want you guys to just think about these questions, and please feel free to talk at me. I want to stop talking, but really, how do you access the care you need? And what do you think is going well? What are continued challenges with Montefiore? What extra resources do you feel like you need for your care to actually achieve what you want, right? We want you to have a really good quality of life. We want you to have a good family life, a good work life, and live long, right? How can we really redesign your care experience? Again, what's going well? What can get better? And then what does like total care look like for you, right? Like, what's the total package here, and what role should and can we play as a health center? I know these are big questions, but just kind of starting the conversation. And that's it, really. It's just really, I would love to just start the conversation. I hope that this is the beginning of many. If you have additional thoughts, want to continue the conversation, get things on paper, this QR code is actually a link to a form with the same exact questions, but you can also leave your contact info, and I'm happy to reach out for a more involved conversation.
I have a question or a thought. We're
Yes.
having a health fair at the end of June. Would you
I'm
be
sorry.
interested in having a table at the fair where people could stop by and they can talk to you? You could address the questions that they may have, or you could say, you know, this is the question I have. What can we do to address that question?
I would
And
love
you could
to.
have an interaction.
I would love to. Yes, I would love to. Put me in front of anyone. I want to talk, you know. I am actually a part of Bronx Week on Sunday, but I don't know the location that I'm going to be in. We are setting up a tent for me called Community Conversations. It's just me and 1 or 2 chairs with some coffee and some donuts. And I want to hear the good, the bad, the ugly, because we got to fix this. So
Do you have a,
All right, then I will get back to you, if I may, and,
Sure.
you know, and then you'll get back to me. No food allowed because Bronx House kind of keeps kosher, so, you
okay.
know, it
Problem.
could be brought in, maybe water or whatever, but, and then we could set you up with a table, and I think that would be great where you could have these conversations.
I would love
As the
that.
people stop by. Do you have pamphlets and stuff to, hand out, or questionnaires?
Yep. Yep. I'm
So,
really
yeah, bring
here.
them along.
That sounds great.
All right, great. Anyone else with any thoughts or questions at this point?
since I have the PowerPoint, I'm on the social media committee.
Mhm.
So I'm one of the people who's able to post onto the community board Facebook page
Okay.
and the Instagram. I can always share that QR code if you want
That would
and
be
get
awesome.
more.
That would be awesome. Yeah. Again, like everyone has a voice. And so I know you're one group, but there's so many. So I'm trying to figure out how to reach as many people as possible.
Oh, this way you'll be able to meet or get quite a few different people from different backgrounds, from the web pages to in person.
Yep. I would love that. And I think like really just, I would really like to not just have community members and patients as consultants. We really want to integrate, right? Like, what's a thoughtful way that we can actually have people working together? And it's paid work. This is not going to be voluntary unless you want it to be. But like, we got to pay for people's time. So I really need to understand from your points of view, like what works,
Agreed. I think, moving forward, it'll be interesting to see, if somewhere down the road, we can continue the conversation so that we can get a sense of what you're hearing. And then maybe those are things that we can focus on as a committee, as a community board to kind of,
That's a great idea.
work together.
Almost do like a listening tour and then come back and
Yeah,
report.
yeah,
Mhm.
that would be
Oh.
awesome.
I would love that. I mean, are there just, and I don't want to take up any more oxygen in the room, but are there kind of like hot button issues that tend to come up in your committees that I should just know about up front?
Well, what about, Naomi? You're on the, equity committee, are you not?
Yes, I am. And I was gonna say,
You have to make- come up, and we'll let you talk now.
yeah, Shivani could, and also Sin is on the, yeah.
The co-chair.
Oh,
Absolutely. It'd be great if you can come and talk to DEI. I don't know if whatever, I don't know, Sin, if you have any thoughts on that as well. But that would be great if you could talk to us. But I can just tell you from the perspective from being on the board, diabetes is huge, cancer screening is huge, heart disease, asthma, are primarily are chronic diseases that are brought up a lot.
okay.
Right, and we had Dr. Coulter speak on colorectal cancer, and he talked about, getting more people to even have knowledge of what tests are out there and to get them, because the sooner you nip it in the bud, the outcome is so great
Right.
with colon cancer. So, yeah, and Naomi addressed some of the issues, but I know diabetes is a biggie, and some of the others that you mentioned.
Well, if it's diabetes, I
That's
have
your-
some
that's
idea.
your
That's
thing.
my big corner of the world, yeah. But I do think really like, how do we, there's a lot of community programming that we can do, but I also want to make sure that when people do enter our doors, they're getting the care they need, right? Like we have a responsibility within our doors to be able to give dignified care that's actually something that you're using your time to use and get and receive. So that's the kind of stuff I need to hear.
Well, hopefully we'll be of help, and hopefully with the social media page and the help there, you can get some of that help sooner than later.
Thank you so much. I really appreciate it.
Thank you.
You're welcome. Is there anyone else with any questions or thoughts? All right. Thank you for coming. Ms. Camagon, is Claire
Yes.
ready?
Yes.
Been able to get on?
Can you
Yes,
hear-
Claire is on now.
Can you hear me?
Are you Claire?
Yes, I am. Hello, everyone.
Great. Hi.
Okay, my name's Claire Hughes. I'm a nurse at the Hutch, Westchester Square. I've been at Montefiore for 11 years since they took over Westchester Square and left us an emergency room and an ambulatory center. But since COVID, we've been at the Hutch now. So that's a little bit of background. And starting in August 23, nurses heard about plans to have pediatric patients transferred to Montefiore Hutch from the Children's Hospital at Montefiore, which we all call CHAM, with no training or clear timeline to provide nurses with the resources and expertise they would require to care for pediatric patients. Now, let me explain this. Doctors have specialties, well, so do nurses. It takes, if I was to transfer over to the CHAM division, I would get 3 months training, plus I wouldn't really be proficient for about a year. It takes, pediatrics is a specialty, and we are all adult nurses at the ambulatory center. So you can understand our concern for these patients who will be entrusted to us. Okay. So the nurse, our contract specifies training, as I said, at least a 12-week training. Management in November came to us with an inappropriate training plan for nurses that amounted to 3 days of class time and following somebody at CHAM, not nearly enough time to prepare nurses to take on pediatric patients. Last month in March 2024, they started rolling out the plan despite nurses openly sharing their concerns with management over the last few months. Nurses were told they would begin receiving pediatric patients on Thursday, May 2nd. Yet they heard there was already a surgery with pediatric patients on May 1st. So you can understand our very deep-seated concern that not everybody was even given the minimal training, and we were yet going to receive patients. So we feel that Montefiore has failed to provide appropriate training for nurses to provide quality care for these pediatric patients. Nurses are not equipped with the necessary training, resources, and time to feel confident that they can provide the quality care these patients deserve. Pediatric care is highly specialized. The skills needed to care for young patients are not immediately transferable from adult medicine and vice versa. Montefiore has an excellent children's hospital where surgeries have been successfully performed for years. Hutch is an ambulatory center that has always treated only adult patients. There are no separate waiting areas or recovery rooms for pediatric patients. There is not a connected emergency department like there is at Westchester Square. So if there are surgery complications or emergency situations, which can be more common in PEDS patients, these patients would have to travel to another hospital for emergency care. Sometimes when we do have to transfer patients, it can take quite a while to get transportation to another facility. Management has unilaterally implemented a program that could negatively impact the care of some of our most vulnerable patients in our community. They have failed to listen to nurses' concerns about our training to take care of these patients. Children in our community deserve the best quality care with the appropriate staff, training, and equipment. Nurses are fighting to make sure nurses get that care, and we're asking for the community support in their fight for safe staff and quality for children at Montefiore. Montefiore has always, in the past, been willing to work with the Nurses Association and collaborate. We don't understand why this had to be done so immediately that everybody could not be fully trained or another appropriate facility could have been utilized, and why they cannot stay at the CHAM hospital. Montefiore must stop shuffling pediatric patients around based on hospital administration's unstated needs and instead prioritize patients' needs for quality care. Nurses are demanding that Montefiore provide appropriate training for nurses who are assigned to care for pediatric patients at the Hutch instead of mandating inappropriate and insufficient training for all nurses that leave us feeling unprepared and concerned for patient safety. I just want to say also that we so appreciate everybody here listening to us and hearing our concerns for our children in the Bronx who absolutely deserve the best quality care. I want to thank you for listening, and anybody have anything else to say?
Yes, this is Mrs. Unger. How can Community Board 11 help you in your quest for the proper training and care, etc.?
We could get you the phone number. Oh, go ahead. I'm sorry. Go ahead. Julia, is that you? Naomi?
Yeah, I was just gonna say, Ms. Unger, I'm sure that you have your connections with Montefiore. Perhaps a letter from Community Board 11, stating the concerns that we have, also advocating for the training that the nurses need in order to care for the pediatric patients, would be helpful, or if you have a meeting coming up with them, and bringing up this concern would really help the nurses a lot.
All right, we cannot vote on it at this meeting, but we can bring it up at the leadership and the full board meeting, explaining your concern and what
Thank
you
you
would
so
like.
much. Thank you.
Thank you. And we can also, if you would like us to present at the full board meeting, we would be more than happy to do so also. If you would like us,
Usually you're only, at the full board meeting, you're only given 3 minutes, but I am sure you can definitely, present, and we would give you some extra time. Or you could ask and we could give it to you.
right. And you can also bring it up at your leadership meeting, so that way they already have
Yes.
some sort of background.
Right, correct.
Okay, is that at the end of May is your full board?
Yeah, the full board meeting is, let me look at my calendar. It's the fourth Thursday in the month. So it will be,
23rd.
May 23rd. Yeah.
Okay. At
And
7.
the leadership is May 16th, is Thursday.
Oh, but we're not attending that, right? The May 16th? We can-
No, you cannot attend.
Yeah,
the
the
leadership.
23rd is what we're gonna be attending. Okay.
Correct. And that will be at the Lubin Hall at Montefiore. Oh,
Okay.
Einstein, I'm sorry.
Is there a virtual option, or just in case?
You could do Cynthia, they could do a virtual option, right? But they would have to sign in as a gallery speaker. You would have to go to the community board website and request to be a gallery speaker. And you
Okay.
should do that sooner than later.
Great. I'm wondering if Ms. Unger, you had any from the committee, has any questions, because we have a bunch of nurses here on the call that they may answer any
Well,
questions.
we're leaving it open. Anyone have any questions? Cynthia, Ms. Randall, Naomi, anyone?
No.
I did have a question. So this is for both outpatient and inpatient surgical cases. What,
No,
I completely understand what the,
this is for outpatient. The inpatients for now will stay at the Children's Hospital. But
That's the one off on Hill Road, correct?
yes, it is. They're bringing they want to bring all the ambulatory over to the Hutch. And we don't know where everyone's gonna fit in. We're at full capacity also.
Yeah, my other question is, you need special equipment and stuff for children.
Absolutely,
can.
yes, we do. And we don't see all of it, yes.
All right. Anyone else with any questions or concerns at this point?
Nope.
I thank you, because I know how wonderful the hospital is, the Children's Hospital on Gun Hill Road is. And I'm really surprised.
Yes, a lot of people are, yeah.
Anyone else? All right, then we thank you so much, and we look forward to hearing from you. And you will send or the information or the phone number or who would we write the letter to with the concerns? Is there a person in charge or someone? Hello?
The CEO of Montefiore is Dr. Ozawa. So, but I'm not sure if there's anyone in particular, Noemi, maybe you know if there's a person, or we can follow up by email. I can send it over to you. If there's a particular person that would be best to receive your letter.
Yes, it would be
If
the
you,
VP Jeff Frieda. Well, we could we actually have a flyer that we have available where it's a call of action where we have an email and a phone number. So I'll give that to Julia and she could pass it along to you with all that information.
fine. Oh, also, as I mentioned, we have the help there. If you have a flyer, maybe someone from your organization may want to have a table there, hand out the flyer, and talk to parents who come in.
That would be great. When is the health fair again?
The
June
health fair is
20.
June 23rd.
Okay. June 23rd. Okay.
On that letter, we would also CC Susan Green. She's in charge of operations, so.
All right, well, you'll send me
Yes.
the information, and then I will get back to you about the health fair and verify that you want to do that, and then I will send the other information to the district manager
Okay.
once we the letter.
Okay. I will communicate
all right.
and follow up by email.
Everyone,
Julia, if you can email me as well with the call to action, I can share it on our socials.
Yeah,
Oh, great.
My email is in I put my email in the chat.
Oh, there you go. Cynthia, right? Okay. I got it.
Yes.
yeah. I would have sent it to you, Cynthia, but fine. So you'll get it right away. Terrific.
Great. Thank you very much. Thank you. Really appreciate
Thank
it.
you.
Thank you.
And,
Appreciate your support.
and thank you for bringing this to our attention. Because it seems
Thank you.
to, not giving the same quality down here, the quality of care as you do on the campus up on Gun Hill Road in the Children's Hospital.
Definitely.
Right. Okay. Thank you so much for coming and presenting. Now, one quick question. Has Sandra Horn got on from Abbott House? I guess not. All right, then. Are there any other questions for the people from the gallery? And I just wanted to talk about the health fair. And I wanted to thank Cynthia for, recommending people, and Joanne. And we have quite a array of groups, so hopefully we'll have some more coming. And I wish many others on the committee would possibly have suggestions or groups that may want to have a table.
Hello.
Hello.
Hi, it's Kay Cardona. I'm in the gallery. I just wanted to mention, as a healthcare worker, I see what Monty's been doing, and their rapid expansion is actually predatory. They're expanding all over the place. I'm hearing complaints from nurses. I'm a CNA myself for 21 years now, and I'm hearing from CNAs and all sorts of workers what's going on with Monty, and it's pitiful. It's pitiful what they're doing, and it's so unfair to the staff and to the public in general. So I absolutely support the nurses from the New York State Nurses Association. I'm also a member of NNU, National Nurses United, and we advocate all over the country for systems like Monty and CVS, which is taking over in medical care. Also, they're buying up facilities all over the country and stuff. So I just wanted to say that I totally support the nurses in this. And if this letter that's being drafted, if the public is allowed to sign on, or if we're allowed also to communicate with management or corporate, whoever they are, if that's a possibility, could the board reach out to people like me
Hey,
and let us know what we can do?
Katie, I'm sorry that I butted in, but aren't you on the health committee?
I guess I'm like an ad hoc. I never submitted a letter to the board that I'd like to be like an ad hoc member or something.
Well, I thought you were on the committee, but why not bring that up at the full board meeting, what you're saying, to get it out there?
Absolutely. Absolutely.
Okay.
I'd be more than happy to do that.
Oh, yes, I see your name all the time up there. Okay. Great.
Yeah,
I
mean,
know,
it's,
and you know, what's more important is profits before people. And I don't know, Montefiore was so different even 20 years ago than it is today.
walk through the Jacoby campus like I do several times a week because I use that as a route to get to the parkway and then to get to work because I work up
Right.
near I work near what is the name of that place? Kings Harbor. I work in that general vicinity and I walk through the
Yeah.
campus several times a week and I am seeing Monty's name like Einstein on more buildings in the Jacoby campus. Jacoby is New York City Health and Hospitals, so I have no idea why
Right.
this is taking place. And it just seems like a predatory move on the part. So I don't understand what the connection is there, but I find it worrisome. I find it
Wow,
worrisome because I
interesting.
really do not care for Einstein as someone that's in healthcare. I've seen patients go in and out of there and friends of mine, and I don't particularly care for the level of care that people get there. I actually prefer Jacoby, and I like working with their staff better when I have a patient that goes in there for some reason. So this is worrisome too, because I find the level of care at Jacoby is better. If Einstein's going to be encroaching on this, I want to know why, and the public needs to know why and where we stand in terms of medical care. Should we require hospitalization or even outpatient care? So I
You
want
know,
to know
Kate,
why. I'm sorry.
why don't you become a guest speaker or in the gallery and bring it up?
I'd
At
be
the board
happy.
meeting, hey, why don't you sign up to speak at the next board meeting for
That's
the
what I'm
gallery
saying.
section?
All
That's
right.
what I just said. That's what I just said. Go on the Community Board 11 website and sign up. And if
Okay.
you need a little extra time, we'll make sure you get it. Because
Okay.
that's really it's concerning to hear what's happening.
It just worries me as somebody that's in healthcare. Like the average person might not see these things or take notice of it, but I do because it affects the level of care that people get. And that's concerning to me when they put profits over people. It's very concerning to me. And this is one of the things that NNU has been fighting. That's why I joined them during the pandemic, because it was already frightening enough. But if this sort of thing is going to continue, it has to be fought because we should come first. We're the patients, we're the public, our insurance pays for what they do. So, and this
Right.
is why it's of optimum importance that we get what we need. It's very nice that they drive around in Mercedes and get nice bonuses, the executives and the corporations, but it's more important that the public gets what it needs and the staff gets what they need, and they're treated with respect and dignity.
Thank you, Kay.
You're welcome.
Understood.
I'll shut up now.
No, but please don't shut up. You're going to sign up to become a gallery speaker
Okay, we'll
at the
do.
whole board, and you can do it remotely if necessary.
Yeah,
And
we'll
do you mind if I send you that, the link to that form? Because I'd love to talk to you more. I mean, this is kind of why I was here too. I need to understand what's going on.
Absolutely.
Oh, who is Dr. Giovanni?
Oh, this is, yeah, Shivani Agarwal. This is kind of what I was
Yeah.
hoping for, right? Is these kind of conversations. We got to figure this out.
So
Absolutely.
is that well, that's your call.
It's okay, I'm hardy, I can take it.
Serena's hand was up
Oh.
a minute ago. Serena, did you want to say something?
Yes. Can you hear me?
I'm gonna mute.
Yes. Let me mute myself. Okay. Why is there like reverb? Okay,
You're-
I hear a
Can
you guys hear me?
You're signed in twice, Serena. That might be it.
Okay, let me get out of here. Okay, better? Can you hear me now?
yes, with no echo. Oh, I
Are you able to hear me now?
Yes.
Yes,
Yes? Okay, I can't hear you. That's kind of,
You're on mute, Serena.
Now you're muted, Serena. You're muted
You're on mute.
okay, how about now?
I
now.
can hear you. Yes.
Okay, perfect. Thank you.
And
Thank
I-
you for bearing with me. I don't know what's happening today. For the Sandy, just wanted to share with the committee and everyone here today that for the 23rd, there will be 2 mobile units present, a dental mobile health unit providing dental screenings, as well as a mobile health unit providing blood pressure screenings and HIV testing and counseling for the health fair on the 23rd. And there will be a dental provider on the mobile unit as well. So just wanted to share that.
thank you. Just send me a little email so, you know, that I could write it down in my notes. But I'll remember,
Yes,
so you want to
actually,
do HIV?
I actually
blood
sent you an
pressure,
email last week when I spoke to the Bronx House.
Right. I know
So
you
I'll send
wanted
another.
Terrific. All right, anyone else with anything to say? And I thank you, Serena, for getting that done.
I'm sorry, we're at gallery. I don't want to overstep.
No, who's that? Naomi?
Yeah.
Oh, you're in gallery now.
Okay.
ahead.
Can I, is anyone else have signed up? I just wanted to say something briefly.
No, not that I know of.
Oh,
So-
okay. So I just wanted to encourage the community members and the committee members. Dr. Agua is very passionate about health equity, and this is the time to express whatever issues you're having in terms of healthcare access. Because I think Montefiore is taking a role in trying to make improvements and making sure that people have the access that they need and the care that they need as well. So I just wanted to encourage the committee and the community members to fill out the form, try to um, work with the people that are coming to talk with us so that we can make improvements.
Thank you. And I think having a table at the fair will be great.
Thank you, Naomi, and
yeah,
yes, yes,
I was going to
No.
say to Giovanni, come with pens and
Right.
paper, and maybe and that they could do it right then and there.
Yeah, come ready to talk and come ready to open up,
Right, and come
and
prepared.
have a real
And we could always
conversation.
set aside another table or area where they can go to fill it out.
sounds great.
Okay, we're trying to help as best we can.
Ms. Hughes has her hand up.
Hi, I'd just like to quickly thank Ms. Cardonia for her support. And it's very nice to hear that somebody sees what's going on. Thank you, Ms. Cardonia.
Yeah, she has been some of our eyes and ears with the health committee and the whole community board. She does speak up, and it's great. And I had no idea that Montefiore had so many different places on Jacoby's campus. Okay, anyone else? So Cynthia, I think it's time we could wind up.
Thank you, Sandy. So
Cynthia?
you want to adjourn the meeting?
Yes, well, thank you for being there. Because
You're
believe me,
welcome.
I'm really not up to par, but thank you so much. And thank everyone else for coming. and
Thank
speaking.
you all. Meeting will adjourn at 8:16 PM. Thank you all for coming.
What? Oh, do we
Thank
have
you.
to tell Jeremy to stop recording?
I will,
Yeah.
I will.
You will? Okay, I was gonna do it. Okay, fine, Cynthia, it's up to you. Again, thanks. All right. Have a good night, everyone.
Night, thank you.
Good night.
Good night. Thank you.